Hey everyone, welcome to the next episode of the First Gen Psychologist. So, the purpose of this series is to cover topics that destigmatize mental health, as well as topics for personal development and empowerment centered on the first gen experience. I'm Dr. Lisette. I'm the first gen psychologist. My pronouns are she, her, ella, and I am a first gen Latina psychologist, leadership coach, speaker, writer, and today I am your host. And today we will be learning more about a very important topic. And so the topic is ADHD and mental health. And we're doing this to celebrate neurodiversity during Mental Health Awareness Month. And we will be learning more about this from Doctora Janice Castro, and who is a licensed psychologist and speaker. So let me share a little bit more about her, and then we'll get into this conversation. So, Doctora Janice Elena Castro is a licensed psychologist residing in Los Angeles, California. She was born and raised in Maryland to Peruvian immigrant parents. Dr. Castro is bilingual, bicultural, with a deep commitment to addressing issues of social justice and increasing multicultural awareness in her work as a psychologist. She specializes in providing therapy to individuals from diverse backgrounds and has a particular interest in serving the Latinx community. Dr. Castro is dedicated to promoting mental health and wellness through public speaking, workshops, and community outreach. So we are very lucky to have her with us here today. So, Dr. Castro,
Oh,
how are you
thank you
today?
so much. I'm doing really well now that I'm here with you.
Yeah, I'm so excited to have you on. And also to add, Dr. Castro is also a personal friend in addition to a colleague. So it's always extra nice to have friends on
Yes.
here. So this is a topic that I know a lot of people have interest on and have always, a lot of curiosity in. I think I frequently have folks who ask me about ADHD, like curious about how to get diagnosed. And so this conversation is really just the surface level conversation on learning more about what ADHD is, maybe a little bit about what it isn't, and we'll go from there. So let's go ahead and just get started with. I keep talking about it as ADHD because I think that's commonly what we talk about it as, but that's an acronym for something. So let's just get into that a little bit. So, what is ADHD and what are
Yeah.
common symptoms, Dr. Castro?
So ADHD stands for Attention Deficit Hyperactive Disorder or Hyperactivity Disorder. It is a neurodevelopmental disorder. And it used to be called ADD, and then the DSM switched it over to ADHD to encompass the three different types of ADHD. So the three different types being the inattentive type, the
Mhm.
hyperactivity or impulsive type, and then the combined type. So people who have both inattentive and hyperactive symptoms. And
Mhm.
when it comes to the inattentive symptoms,
Yeah.
it's, for example, forgetfulness, making mistakes, like careless mistakes. It's hard to sustain your focus. It's hard to listen to others when they're talking to you,
Mhm.
being disorganized, also having difficulty following through on some responsibilities.
Mhm.
Some of the symptoms for the hyperactivity or the impulsivity aspect of it is people who
Yeah.
are very fidgety, difficulty staying seated when you're expected to be for like long periods of time,
Mhm.
feeling like you're on the go, talking a lot, sometimes so much that you'll interrupt others, either in like the middle of a conversation or maybe you're having difficulty waiting your turn, and so you blurt out answers. So yeah, those would be some of the symptoms related to the inattentive and then the hyperactivity symptoms.
Yes, yes. And then just to summarize, so when we're talking about ADHD and an ADHD diagnosis, there's typically three subtypes. And there's the one that's inattentive, which where Dr. Castro shared some of those symptoms, then the hyperactivity or hyperactive, and then there's a combination where you may have experienced both. Um, and
Yeah.
so, we're talking about what it could look like, but let's transition and shift a little bit and thinking about, well, what are some of the strengths for individuals who have ADHD? Because I think when you hear this diagnosis, and I'll say like I have numerous people in my life who have this diagnosis and have are learning how to navigate the world from a neurodivergent perspective, there's moments where they experience they feel very discouraged. They feel really discouraged at moments because they feel that certain things are so much harder for them than someone who doesn't experience these, who's someone who's neurotypical. And so what would you say are some of the strengths of individuals who do have ADHD or have an ADHD diagnosis?
Yeah, I appreciate you bringing up how individuals with ADHD can feel discouraged and how there has been this transition in being able to consider it as part of neurodiversity. I feel like that's a term that is it was coined, I think, like in the 90s. And so it's something that allows us to be more accepting of human diversity, right? And part of that human diversity, while there are symptoms that make life feel harder to be able to adapt to because we live in a neurotypical world, neurotypical society, some of the strengths that get overlooked, but that I think are really important to remember and to notice in ADHD folks is the creativity. There's so much creativity when it comes to ADHD. A lot of energy and enthusiasm. I know that from a negative standpoint, impulsivity can be something that could lead to like risky behavior, or maybe like not good decisions. But if you look at it from a strengths-based approach, it can be looked at spontaneity. Also being able to hyper focus. That's something that, while yes, distractibility and difficulty sustaining focus is an inattentive symptom, once you're hyper focused on something that you're just really interested, it can feel like you're going down a rabbit hole. But if you have a hyper focus on something you're passionate about, it can get you really far. And
Yeah, no, I love that.
resiliency.
Yeah, no, I love bringing. That's why I was like, this is such a good question. Thinking about the strengths, because oftentimes there's a discomfort around this, and that thinking that it's not it's just something that's negative for folks. And so understanding that there are a lot of strengths, and that creativity, I think, is such a good one to like highlight. And then so absolutely. So something else that I've noticed a lot of people will ask, it's like, is ADHD something that you can only be diagnosed in your childhood? Is that the only time you can happen, or can you be diagnosed as an adult with ADHD?
That's a really good question. You can be diagnosed with ADHD as an adult, and it does manifest in childhood. So when it comes to the symptoms that I was talking about earlier, technically to like qualify or fit the criteria for ADHD, the symptoms have to be present since childhood, at least before the age of 12. And the thing is, it's going to look different, right, from a child versus an adult. So, for example, in preschool, it might look like a very hyperactive child who's like climbing and running everywhere, can't stay seated. But then maybe in elementary school, the hyperactivity might go down, and it might be more inattentive symptoms that start to come up. And then it continues all throughout like middle school, high school, and college, and then into your first job or your first career. And maybe the hyperactivity may not be there because we don't typically see adults running around climbing, but you might see some impulsivity still come up, right? That's why I said hyperactivity / impulsivity symptoms, because as adults, it looks more like impulsivity. So yeah, and unfortunately, because the prevalence is higher with males and females, what ends up happening is a lot of females, like little girls who end up growing up to be women, they get overlooked and they're misdiagnosed or don't get diagnosed at all with ADHD.
Yeah, so it sounds like there's a higher rate of diagnosis in boys, in young boys or men, than there is for women. So more common.
Yeah.
Would you say? I guess I'd be curious if more women are being diagnosed in adulthood then, once they're realizing and seeking out resources. I know, correct? Like I know someone, when I was in my doctoral program, one of my colleagues was diagnosed with ADHD during this doctoral program, and I say this because I think there's also like So there's discomfort with seeking that diagnosis, especially when you've achieved such high levels of education and thinking, oh, I got into a PhD program. Like like if I can do this, then like, does that make me too neurotypical? Like, does that, and so kind of wanting to normalize. So I share that example to normalize. It's like, you can't get diagnosed later because the reality is when you've had to learn how to navigate the world and compensate to navigate any of these maybe ADHD symptoms that would come up for you. And then there's at some point where you realize maybe the resources or strategies you were using just weren't or are no longer as effective. And that's when you start to see it maybe impact your quality of life more and can seek out the diagnosis, right? So I think that's what happened for my colleague, at least, when they sought that out in the program.
Yeah, for sure. And I think something to keep in mind is also how the severity of ADHD is going to vary. Like for some people, it's not as severe as others, but that doesn't mean that they don't have ADHD. It's just, it looks a little bit different.
Exactly. It looks different for folks. And so, we talked a little bit about what some of the symptoms are, remembering three of the categories, the inattentive, the hyperactive, or the combination of the two. We talked about some of the strengths, highlighting particularly creativity. And now we talk about impulsivity as, maybe not so great, but spontaneity, like being able to step out of your comfort zone or like push yourself out of your comfort zone and trying new things. And so, like when you can be diagnosed, but something that I wanted to make sure we highlight is, how do people typically treat ADHD? And, I may have some follow-ups here depending on your answer.
Yeah. So with ADHD, you have the option of medication. There's stimulant and non-stimulant. So it's best to consult with your psychiatrist to talk about what works best, because I know some people have concerns about getting addicted to it. So it's always good just to consult and ask those questions when you meet with your doctor. And then also therapy, ideally a combination of both. But yeah, I would say both of those strategies are what helps with ADHD and being able to treat it.
Yeah. And you know what? As I'm asking you this question, Dr. Castro, I was thinking about how we didn't talk about how someone gets diagnosed with ADHD. Like we're talking about when.
That's a really good question, right?
And as someone who used to do ADHD, I was like, I can't believe I didn't bring this up. So let's have you share, like, how does someone like find out they have ADHD? Like, how do they get properly diagnosed for that?
Yeah. So people take different routes. Some people will get diagnosed through their psychiatrist. And some people will go through the psychological assessment route, which I'm imagining that's what your experience was. And so that psychological assessment is more thorough. It has the intellectual testing that allows for an understanding about what are the areas of cognition that maybe you're scoring lower in, because when it comes to ADHD, what gets impacted a lot is your working memory. And so in the intellectual test, there's tests for working memory. So yeah, ideally, I think psychological reports are very thorough if you go through an assessment, because it allows the understanding also of the complexities with people who may have ADHD and other diagnoses, right? So for example, people might have ADHD and anxiety, or ADHD and post-traumatic stress disorder. And so how do you distinguish what symptoms are what diagnoses?
Exactly. Yeah. So getting an assessment, and that's usually done through a psychologist. And so for that, for those of you who are maybe listening to this, you have that interest, reaching out, if you have a health insurance, reaching out to your insurance provider to learn more about what they cover in terms of psychological tests could be helpful. If you can do it out of pocket, finding a psychologist who does these assessments. Usually there's different directories where people can search, like psychologytoday.com. I know is one where I've been able to find other therapists who maybe do assessments. And sometimes you're a psychiatrist. If you work with a psychiatrist, sometimes it'll be like a temporary diagnosis while they're waiting for you to get tested, and they'll provide you with referral sources. And so, so just to add a little bit to like what that process is, but what we're looking at in the assessment is the working memory, which is How much can you hold in your mind at a given time, right? If I ask you to remember something, how long will you be able to remember that for? How long can you like navigate that while we're also having another conversation? And the second one that I wanted to add is the processing speed. How quickly
Yes.
how quickly are you able to access that information then? And slower, faster processing speed does not necessarily measure your intelligence. It measures how quickly you can access that. And when you're neurodivergent, your brain might be using a different pathway, so it might take a little bit longer, and that's okay. You
Yeah.
still get the same
Yeah.
answer, right? But
That's
okay,
right.
awesome. So I know that we're running close to the end of time, so I want to do two more questions. So one is just generally like, do you have any tips for folks who maybe have ADHD, like a strategy you'd say, like, here's a strategy that might help improve your focus and concentration? And I know there's a big ask, so no, it's small. This is a small tip, a small consejo from someone. So, yeah.
So like we talked about, when it comes to neurodiversity, it's appreciating the human diversity, right? And also how ADHD, it varies in terms of severity. So there's different strokes for different folks. Different things work for different people, and they work until they don't. And then you got to try something new, and then it doesn't, and then it stops working, and then you try something else that you tried 5 months ago. So it's this constant getting creative and entertaining yourself to be able to stay on task and do the things you want to do. So some strategies could be, for example, I think chunking is really helpful. So chunking being that you break things down into small pieces or small goals to
Yeah.
be able to meet your long-term goals. So thinking to like, for example, SMART goals, right? SMART goals are a way to really break down your goal so that you can be able to meet that long-term goal of yours. Also being able to reward yourself. So often we don't reward ourselves. We're just like, okay, I got it done. What's next? And we don't stop and be like, okay, I did it. Like, I want to reward myself with something.
Yeah.
Because if we reward ourselves, then it allows us to really feel motivated to do it again, and to keep going. And also being able to make things into a game. Like,
Yeah.
that's part of the challenges with ADHD is having to have that novelty. And
Yeah.
that means because creativity is one of the strengths, then it allows someone to be able to be creative in how they keep themselves entertained. So, does it mean that while I'm warming up my 3-minute mac and cheese in the microwave, I'm going to use those 3 minutes to wash my dishes? And that's you getting creative. You're timing yourself to do another task. So multitasking is helpful in that way. Or maybe it means playing some music in the background. Maybe your favorite song plays for like 2.5 minutes. You have 2.5 minutes to pick up as many items from the floor as possible to clean up your room.
I love that. Yeah. So in that I heard the chunking, right? So like breaking something up into smaller goals, and a way to do that, there's a format called SMART goals, and that SMART is an acronym. If any of
Yes.
you are interested, like look that up. It's like specific, measurable, attainable, realistic. I always forget the
And
T.
timely.
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 Something that can
But
happen.
time is very nebulous when it comes to ADHD.
Yeah.
So breaking it down is helpful
Doing
so that
that.
you can meet your goal in a timely manner.
Yeah, so breaking that down, so chunking it into that, and then having fun with it almost is what I was like, trying to find ways to make sort of the hard
Yeah.
task a little bit funner. And I think a term I've heard for that is temptation bundling, right? You're doing something maybe you don't want to do so much, but something you really want to do, but and on a smaller scale, right? Like,
Yeah.
don't really want to wash the dishes or pick up your items of clothing or whatever, but you want to listen to the music you like, and so you turn it into a game. You play the song, like, how much can I do in these 3 minutes while I'm listening to the song? So I love these are excellent tips. And the one last thing, since it is the show focused on first gen folks, do you have any considerations or anything you've thought of that would impact uniquely for the first gen community when it comes to ADHD, or just any general consejos?
Yeah. So with first gen professionals, I think about how I know you speak a lot on the imposter phenomenon, right? And how maybe having these questions of not feeling like you're good enough or that you belong are very common thoughts when it comes to having ADHD, because people can feel like they don't belong or that they don't fit in a specific work environment. And then there's this judgment of, maybe this isn't for you. Like this career doesn't work for you. Or we start getting these stories told to us about being irresponsible or careless, and maybe college isn't for you, or that work isn't for you. And so being able to practice self-compassion and rewriting that narrative for yourself is really important. And that falls into, the imposter phenomenon, how that comes up with first generation college students or first generation professionals, entrepreneurs, is maybe it means practicing, mantras. Maybe it means trying to challenge the critical self-talk of using shoulds and have tos and replacing it with I could or I would like to. And being able to talk to yourself as if you are a friend or a child. And that also helps with being able to be more compassionate with ourselves, because you're doing the best that you can, and being able to also explain that to people and setting boundaries, right? I think also part of being a first-gen professional is having a hard time saying no, because we want to seize the opportunities. And what ends up happening with ADHD is a lot of overcommitment, because we forget what we're supposed to be doing tomorrow, because we forgot to look at the calendar, then we double booked. So being able to say no and setting those boundaries would be helpful as well.
Yeah, no, these are really, really good and very specific tips, right? In thinking about with some common experiences for first gen folks is experiencing the imposter phenomenon or experiencing a bit of people pleasing, right? Wanting to say yes to everything, say yes to all these opportunities, and realizing that if you're a first gen and you also have an ADHD diagnosis, that can set you up in a space where, you forgot and you've overcommitted. And in that moment, you also gave us the tip for that, which is have self-compassion and be patient with yourself, because everything takes time. Healing takes time. Finding our rhythm takes time. And so as we close out today, Doctora Castro, how can we support you and your work?
Yeah, I appreciate that question. So you're welcome to visit my website, as I see at the very bottom. You can support me by either, if there's any trainings, speaking engagement opportunities. I love being able to share the knowledge that I have, the resources that I know that are destigmatizing mental health. And I'm excited to be able to open up my private practice one day. It's still in the works, but that's to be determined.
You have a wait list?
Not yet. I got to submit the paperwork first.
Yeah, no. I swear. Doctora, okay, when I say Dr. Castro, Doctora Castro is an amazing psychologist, and I know anyone who gets to work with her is very lucky in whatever capacity they work with her in. But yeah, I highly recommend her for any speaking engagements. I know that this is an area that you feel comfortable speaking on, and could you share just for folks to know, maybe your other top 3 areas you enjoy speaking on?
Yeah, for sure. I enjoy speaking on Latinx mental health, being able to talk about managing stress, sleep hygiene. So that would be a few. Also, psychoeducation on depression or anxiety. So those would be a few different areas. And then also domestic violence or intimate partner violence.
Thank you so much. You have such a wealth of knowledge in so many areas. And so it was so nice to have you here today. I feel like I always learn something new from all of my guests. And so thank you so much, Dr. Castro. I hope that you have a lovely rest of your day. And I'm just going to leave this here for now. But yeah, folks, if you need to reach out to her, this is her email, Janice.E.Castro@gmail.com. And you can always, I will also make sure to link her website in the show notes. So if you wanted to learn more about her or reach out to her, you can reach out to her via those 2 platforms. Okay.
Thank you so much.
All right, y'all. So we're live every Tuesday at 10 a.m. Pacific Standard Time. So please tune in, share with others, subscribe. And see you next time.